Good evening. I'm Pinellas County Sheriff Bob Gualtieri, and I'm here with Barry Burton, the Pinellas County Administrator, and we're back here on Facebook Live to answer any questions that you have about where we are here in Pinellas County and the Safer at Home order that was issued by Governor DeSantis, as well as the orders that are in effect here in Pinellas. Just to briefly update you, and I'm sure everybody is following this because it's so important in our lives every day. The governor's Safer at Home order expires next Wednesday, and we're waiting for word from him and out of Tallahassee about what he's going to do. The governor could extend that order, he could let it lapse, he could issue a new order, and we're looking at our options here in Pinellas depending upon what the governor does. One of the things that I think we're all in agreement with is that it's important that we use the data, we use available information so that the best decisions can be made. And we've been busy over the last few days looking at all of the available information that we have, all that data, so that we can make an informed decision on what's best for all of us here in Pinellas County. So we're happy to answer any questions that you have. Barry, is there anything you want to say to begin?
I think the other piece is that we're planning for options following the governor's order. So depending upon what he issues, there are certain orders that were issued by the Board of Commissioners. So we're, again, planning for those options, but again, waiting for the governor to set the tone in terms of his order and how it impacts local businesses.
Okay, Ricky, we have some questions.
Sure. How is the order affecting attic insulation companies? Are they able to operate right now?
Yes, no problem with that.
When do you think non-essential businesses like salons will start reopening? Is there a plan in place to allow this to occur?
Well, again, that goes back to what I just said, is that everything that is not essential, that cannot operate now, cannot operate until Governor DeSantis decides that they can. Because everything that's not essential and is ordered closed is because they are not on the essential list under the statewide Safer at Home order. So it just depends upon what he does. And there are a number of scenarios that could play out, but everything turns on what the governor does as far as allowing what are now non-essential businesses to again operate.
We've been at this for some time, and so I think we forget that originally the Board of Commissioners issued a Safer at Home order, which allowed businesses to operate under modified practices. It was when the governor issued an order saying that you can't leave your home except for essential services that really modified and required small businesses and non-essential businesses to close.
Sheriff, what does the stay-at-home order mean for child custody visitation?
It doesn't address it at all. So there's the way the orders work is that it tells everybody what they can do, and everything else they can't. But again, it defines as essential services and activities. So it doesn't address that at all. People should abide by the court orders, and if they have shared custody or shared visitation, they should abide by the court orders.
Are there any plans to allow condo pools and community pools to reopen with limited occupancy?
That's something that we're looking at right now. Both the pools, the issue of condo and community pools or hotel pools, and beach closures along with playgrounds were part of the county's orders. We're looking at both of those right now. We're trying to align those with recommendations with where the governor goes. But again, we're going to address that with the Board of Commissioners next Tuesday at their next meeting.
I'm a gym owner and would like to go to my gym to make workout videos for my clients that are cooped up at home to post on social media. Is that allowed?
Yes, no problem. Go ahead.
Have there been any additional arrests or near arrests of business owners not complying with the Safer at Home order?
Well, we're really trying not to have to take any enforcement action, but over the last few days, I think that people's patience are waning and they're growing weary about all of this. So we've seen some pushback, but we're trying not to take any enforcement action. We really don't want to do that at all. We only had to do it once, and hopefully that was the first and the last time. So we're hopeful that the landscape will change to some degree, and I just don't know what, within the next week, and that'll give everybody a little bit of a reprieve here. And again, we have to make, and everybody has to make, whether it's the governor, whether it's the Board of County Commissioners, it's anybody, everybody has to make what they think is the best decision based on the information that's available. And I can tell you that it's hard, it's tough, because we don't want to see a resurgence of this. We want to see this be put behind us. And as we're looking at this data, it looks like it's going in the right direction. But I can tell you is that it's not a compelling case that it is going down fast. So we have to be careful, and we just ask you to be patient with this, because as hard as it is and as devastating it is for individuals in their daily lives, is that we really got to make sure that we get through this and that we balance it.
Sheriff, you spoke about data a little bit. Is there any new data to share?
Well, I think that's one of the reports we're putting together is the available data from both the state and locally. We have that in several charts. We're going to be rolling that out to the commissioners next week. Again, sheriff's looked at the same data as I have. We've been looking at this with Dr. Cho, with our health department director. And again, I think what the sheriff said is correct. All the signs are good, but again, that's 2 weeks worth of data. And so we think that we're on the right track, and we're going to be making some of the decisions based upon that data.
One of the things I want to say, and I'll continue to say it because we have to make sure that everybody knows what to expect. And I don't think there's any doubt from all the experts that we've talked to and from everything that we know that whenever the current restrictions that are in place are lifted, is that there is going to be an uptick in cases, because as people get back together again and people are having contact, you're going to see an uptick in cases. The question is it within tolerable limits? And that's the balance, and that's the hard part, because we know that you're going to see an uptick. And so this is not a situation where this virus just goes away. This virus is here. This virus is going to stay. And the key to it is managing it properly to keep it at the minimal numbers as we can. But you should know that you're going to see an uptick, and you need to be very, very careful when we do reopen things. That does not mean, in fact, it actually means now it suggests that you need to be more vigilant about your social distancing, more vigilant in your best practices, because there's going to be more contact with more people. And if we all don't do that, then we're going to see the numbers spike, and could, and I hope not, to an unacceptable level, and that would mean that we'd have to re-implement things. So we really need everybody's help and cooperation, but it's so important that everybody know that they really have to double down on their diligence once the restrictions are lifted, so that we don't have an unacceptable spike.
And if we go back to why we implemented this, you've heard a lot about flattening the curve. Flattening the curve was not eliminating it. It was making sure that it didn't overwhelm our healthcare system. Well, even locally, as you've seen in the newspaper articles about local issues we've had to deal with nursing homes. Again, that taxes our resources. It was only a week ago that we were able to get steady supplies of protective equipment for our first responders, for our hospitals. And so it's been a very short period of time where we feel comfortable that we can properly supply them to be able to respond to COVID patients. So, we're talking a real short window where things have been positive, or we're on the right trajectory. We want to make sure that any of our actions don't in turn increase the numbers to where they can't properly respond, both our first responders and our hospital system.
Private in-home daycares that may serve 5 children or less, are they able to be open during this time?
I got to think about. I don't see why not off the top of my head.
I think the governor's guidance it puts out regarding 10 or less per classroom.
And as long as and if it's in home, and in homes not licensed, I don't see any problem with that. Again, we're so far into it now, but a lot of people have challenges, with daycare, especially with having to work and in a situation where the schools are closed. I don't see that as a problem.
What resources is the county or even municipal governments offering for business owners that have been unable to get assistance from the state or federal level?
Well, we're looking at 2 programs that the county's offering, and this is from the CARES Act, the original federal funding. We're going to be working with the commissioners on launching 2 programs. One is going to target individuals that's been impacted by the COVID virus and lost their job, has in some way been impacted, and also small businesses. Both of those programs, we're finalizing the details. And the reason is that the rules for implementation of those programs just come out last night. So those details are being finalized. It's targeted to families, it's targeted to small businesses, and we're going to be bringing recommendations to the Board of Commissioners next Tuesday on a program for both.
Sheriff, what modifications, if any, have been made for deputies out on the street to minimize contact during this public health crisis?
Well, we're not responding to all the calls that we once did. We have a whole list of calls that deputies will contact the person who is making the call by telephone and try and do the investigation that way if possible. We've also restricted the detectives in going out and doing follow-ups and doing interviews. So we're using a lot of technology. We're using phones, we're using email, we're using video conferencing. But if something happens, we'll be there. That's what we do. And but we're trying to minimize it where it is applicable and appropriate to do so. So we are taking steps to reduce the contact and again, using good judgment and discretion in enforcing traffic laws, and that doesn't mean everybody's got a license to just go speed on US 19. But you have seen a decrease in traffic enforcement and proactive policing because we are trying to reduce the amount of contact that the deputies have when it's unnecessary.
CDC added wearing face masks to their social distancing guidelines. If non-essential travel restrictions are removed, will Pinellas County businesses and residents be required to wear masks in public?
You know, I don't see any, under any circumstance, that anybody would be required. You know, it gets kind of complicated when you're talking about masks, but you know, I think I've talked about this before, but it's also important that people be fully informed because the last thing you want to do is have a certain expectation and that expectation not be accurate or not be fulfilled. There's only one type of mask, only one, and you can't get it, that protects you from getting the virus, and that's called an N95 mask. If you have one, then you're one of the few that does. The healthcare community, first responders, et cetera, we have them, but they're very difficult to get. And that N95 is going to protect you. All the other masks that are out there, whether it is a KN95, whether it's a surgical mask, whether it's something that you made at home, whatever it is going to protect others from you. So if you end up in a situation where you've got 10 people in a room and all 10 people have a scarf over their face, that type of a mask, then everybody's safe because nobody can give it to somebody else. But if you have 11 people in the room and 10 have that scarf mask over their face, and one does not, and that person has coronavirus, and that person coughs and sneezes, then those other 10 wearing the masks, then they're vulnerable and susceptible to getting it because that cloth covering over your face is not going to protect you. So this whole notion about masks, if everybody wears one, then everybody's protected. But the only thing that's going to protect you from getting it is if you have an N95.
With school being essentially suspended through the end of the school year, childcare is becoming a problem for a lot of folks. Are summer camps going to be permitted to operate? And if so, how soon? Is there any timeline on that?
You know, it's going a lot of it's going to depend upon what we find out next week and what the governor does. So, you know, the answer is that for right now, I think the answer is we don't know. You know, of course, the schools are closed, et cetera. Will there be summer school programs? Will there be summer bridge programs and all the other activities that usually occur during the summer with schools? So I don't think that we're in a position to answer that right now.
Sheriff, other counties around the state have seen an increase in domestic violence and mental health related calls. What about Pinellas?
No, not really. You know, they're up slightly, but nothing of significance. So we really haven't seen an uptick in either of those two categories, either mental health or domestic violence of any significance.
The last few days, we've heard about a lot of beaches around the state opening up. Any idea how those are going, and if there's any talk of any similar measures in Pinellas?
Well, as far as how it's going in other places is that I talked to the sheriffs over in Jacksonville and in Volusia County, and at first, as they would say, it was a little ugly. In fact, a lot ugly, and it was a very problematic situation because everybody flocked to the beaches. And I expect that when we do that here in Pinellas is that we're going to have a surge of people that go to the beaches, and we'll be prepared for it, and let everybody go and have a good time and get it out of their system, and it's going to happen here. And so we're different though in some respects because we have 35 miles of beach. Those other communities had smaller areas of beach that they had to deal with. When the beaches are open any place, from the experiences we've seen and talking to others in those areas, is going to result in a surge. You can look, and I think today you'll find that, I know I talked earlier with the Charlotte County Sheriff, they're opening beaches down there, Sarasota's opened their beaches. So you are seeing an opening of beaches around Florida. But I don't think it's going to be a problem when that decision is made, and we'll be prepared to help everybody, and hopefully they just have a great time out there and get some sunshine.
Question for Barry. The state obviously having some issues with the unemployment system. Are there local resources for folks struggling with that issue?
That's the program that we talked about, and we really structured that program to where we can act quickly and actually front load and wait for the federal funds to follow, trying to get money into people's hands. We understand that they're struggling getting through the unemployment system, and that's had challenges. Even the stimulus dollars, I hear mixed messages and where that is. So we're trying to make that program happen quickly. That's the reason we're bringing it to the commissioners next Tuesday, hopefully to be adopted and be implemented in the week to follow.
Where can I get tested if I think I may have coronavirus in Pinellas County?
Call the health department. The health department or Baycare both have testing capabilities. Local doctors, you can always start with your doctor. They'll refer you. But there's testing kits in a variety of places, including at the health department's main number, and they can refer you.
Sheriff, have there been any cases of COVID-19 within the sheriff's office?
Or
the county, for that matter?
We had one within the sheriff's office. I'm not sure it's the county.
One within the county.
As a tobacco shop owner, if I recently obtained a food and beverage license, am I allowed to reopen and sell food and beverage along with tobacco products, or only food and beverage?
No, and again, what we've said to everybody is we understand this is tough. Okay? This is very hard times, and people are just trying to survive and trying to run your businesses. But if you are a tobacco shop, tobacco and the selling of tobacco and traveling to buy tobacco products, etc., is not essential services or activities. And what we've said, and just ask people, please don't try and put a round ball in a square hole. Don't play games. Don't try and stretch something into what it's not. If it says tobacco shop and you've always sold pipes and tobacco and all of the stuff that goes with it, etc., and now you've gone out and you're putting a package of soda and chips on the counter and it's for sale, that's not genuine. It's disingenuous. That you're not a convenience store. So we're not going to allow that. We're not going to play that game, and just get through the next few days. And I hope that everybody gets some relief. But we got to be fair to everybody. And if we start allowing people to manipulate and open because they went to Sam's Club and bought a box of Doritos and now they're putting them on the counter, that's just not right. And so we're trying to be consistent and to be fair. And just work through it for the next few days, and I hope everybody gets the relief that they are looking for.
There's been kind of a moving target as far as our peak is concerned. What is the latest on a peak for Pinellas County?
When most people talk about a peak, they're talking about hospital utilization. And that if you go back to April the 7th, it had surge predictions, and those are prediction models about a percentage of our population, how many people get tested, how many people are positive, that we would exceed our bed capacity, especially our ICU capacity in the county. But since that time, that has changed. It steadily went down. The latest models, and again, these are models, do not show us getting anywhere near our exceeding our hospital capacity. So, but other people are using peak as a different thing, like the number of new cases per day or something like that. So it depends on the terminology. I think most people see the surge with the hospital utilization. And that's what we've been trying to get data to where we can get on a common playing field of what we should be looking at to make some of the decisions that the sheriff and I have been talking about.
And to that point, as far as if people are interested in the trend and the number of new cases, is that I would describe it overall, and you have some spikes in there, but there are some reasons for the spikes. But overall, it is relatively flat.
I agree.
And somewhere, if you average it out, probably somewhere in the 15 plus a day range, and you average it out, but it's relatively flat. And that's one of the things that's hard about this because the numbers, as I said earlier, and the data looks like it's going in the right direction. It looks positive. One of the things, I think we could put it this way, and I think we're all in agreement on this, it is definitely not negative. But it'd be nice if we saw stronger downward trends than what we're seeing. But as the administrator said, a key factor in this, as we were talking about flattening the curve, was because of resources. And things are looking very positive as far as the resources are concerned. But we also don't want decisions that will be made that are going to cause those resources to be taxed and for those resource utilizations to go up significantly. The key is that in our worst day and in our worst case scenario, are we within system capacity? Everything points to yes. But if you start getting anywhere near system capacity, then that means you got a problem. So this is truly an art, not a science, and trying to figure this out. And the data is all over the board, and some of it is tough to use. So as we're talking about these different terms like peak, it depends upon what you're talking about as to what the answer is.
So talking about these different terms and data points, what is the difference between a positive and an active case, or is there a difference?
I think a positive case is there's a positive case. However, you may be talking about an active case being within that 14-day incubation period.
And I think in the terminology they're using, there is a difference. There is a difference between the number of cases. If you're looking at the data, especially on the Florida Department of Health website, there's a very big difference in the data between the number of cases and the number of positives. So the number of cases is deduplicated. So if somebody tests positive today, they're only going to be reported once, and that will be reported as a new case. If the person then 3 days from now goes back to get retested to see if they still have it, that's going to show up as a positive test, but it's not going to show up that day as a new case. So in other words, when you're looking at the number of cases that Florida has, that big number, that Pinellas County has, that big number, the 600 plus cases, that is individuals. But when we're looking at the number of positives could be somebody who's tested 4 or 5 times and they're positive before they get negative. So there is a difference between cases and the number of positives.
Do either of you have any comments or concerns about how this may affect next year's budget for the county or the sheriff's office?
Yes. This is a significant impact to our local economy. It's a significant impact to families that are working, and all that contributes to our local economy. So that is something that we're, obviously keeping an eye on, looking at that. But part of it is it's almost at that point where you kind of have to see where this is going, how long we see till businesses kind of not just reopen, but get back to being fully operational. And so we are looking at that, and it will have an impact, and we're going to start, making appropriate decisions to try to just curtail spending, and then also look at the stimulus dollars and other things to continue our operations.
Is there you guys anticipating, the governor, when he may give some sort of idea of what he plans to do for May?
The deadline's next Wednesday. The order expires on the 30th, and that's all we know at this point.
I think stay tuned. The task force recommendations are due Friday, so tomorrow. So,
why are some smoke shops being allowed to do curbside service while others are not?
They're not. If they're doing curbside service, then they're violating the law, and they shouldn't be. And you're welcome to call and report it in 727-582-TIPS, and we'll address it. But curbside is no different than somebody being in the store. Again, remember what the point of this is. The point of this is to prevent physical contact between people so they don't spread the virus. And if you're doing it in a car or through the car window and everybody's touching stuff and they're passing stuff off, that's no different standing at the counter in the store doing the same thing. So You got to look at what the purpose and the intent of this is. And curbside, if it's a non-essential business, then it's non-essential and it can't operate. And whether they're doing it in retail or curbside, it's prohibited.
If anyone experiences price gouging, where should they report it?
We can handle that through the Consumer Affairs Department at the county. So look at the county's website, and you can go to our Click Fix issue, and we'll refer that.
And are we tracking recovered cases in the county?
Not that I know of.
That would be a health department issue.
Yeah, the health department may be, but as far as I know, and if somebody may be looking at the websites, because there are websites out there where they do have tabs for that, and there's no data for it. So as far as I know, that data is not available, and if it is being done, it's being done by the health department.
And why is it that you can go launch your kayak, but you can't rent one?
So this gets complicated. It is very nuanced. Is that, again, go back to that the governor's order is a ban on travel. So you can't leave your house. Okay? The governor's order does not shut anything down. The governor's order permits recreational activity. And I'd say that kayaking is recreational activity. So if you want to take your kayak and you want to launch it, you're good. But a business that is engaged in renting or even selling kayaks, for that matter, is that that's not identified as an essential service. So what's prohibited is for the workers of that kayak business to go there to engage in the renting of kayaks, because, and also for somebody to leave their house to go to rent one, because you can engage in recreational activity. That's under the essential activities side of the order, but the essential services side is what regulates the businesses. And the essential services side, and nowhere in there, is about a kayak rental business. So that's why you can't rent kayaks, because those businesses are not essential activities or services, and they can't operate. Again, it's complicated,
Well,
it's very nuanced, but that's the
and
reason.
it was the way that the order
Yeah.
was written by the state. Okay, this is not how we would have done this, but we're trying to implement a inconsistent order.
I said it to people a lot, is they'll try and apply common sense to the order. Because the things that you see that appear not to make sense don't, from a common sense perspective. And so like the administrator said, is that we didn't write it. If we did, it'd be very different. All we have to do and all we can do is to implement it within the four corners as it's written. Well, we want to thank everybody for your questions and for joining us on this Facebook Live edition. We will join you again next Friday on May 1st at 12:30 to answer your questions, and hope we'll have a whole new set of orders and a whole new landscape, and be able to tell you where we are at that point with a lot of updated information. So again, thank you very much for joining us this evening, and we'll talk to you again next Friday on May 1st at 12:30.